Hey there! So, you've just had a tooth extraction, or maybe you've got one coming up. Well, you are in the right place. We're going to walk through everything you need to know to make sure your recovery is smooth, fast, and complication-free. Let's jump right in.
Okay, so the procedure's over. The tooth is out. Now what? The healing process is what really matters now. We're going to guide you through it, step by step, so you can avoid the common problems and get back to feeling like yourself as soon as possible. You know, the key to a really great recovery is understanding that you're not just healing, you're actually managing two totally different phases, and each one has its own little quirks and its own risk for infection. Knowing how to handle both is absolutely crucial. So, think of your recovery in two main stages. For the first week, the biggest danger is messing up that initial healing process. But, and this is what catches a lot of people off guard, weeks later, a completely different problem can sneak up on you, and that's trapped food. Let's break down how to stop both of these from happening.
Let's start with what is, without a doubt, the most important part of your entire recovery, the first 24 hours. What you do here, or actually what you don't do, sets the foundation for everything that comes next.
So here's the deal. Your body's first move is to form a blood clot in that empty socket. The best way to think of it is like a perfect natural Band-Aid. It's there to protect the super sensitive bone and nerves underneath, and it's the scaffolding for all the new tissue to grow. Your only job right now is to protect that clot.
So, how do you protect it? Well, for the next 24 hours, there are some big no-nos. No swishing or rinsing like crazy, definitely no smoking, and please, no using a straw. Any kind of suction in your mouth can literally yank that protective clot right out of the socket. That leads to a really painful thing called a dry socket, and it just opens the door for infection.
And I'm not kidding. That's it. For this first day, your only mission, should you choose to accept it, is to be a bodyguard for that blood clot. Just let your body do its thing. All right, you did it. You made it through that first critical 24 hours. Now, the game changes just a little bit. Your role is going to shift from just passively protecting to some gentle, active care. It's time to start thinking about keeping things clean without messing up all that good work. And this is the million-dollar question, right? You know you need to keep germs away, but you're also terrified of hurting the area while it's trying to heal. It's a valid concern, but don't you worry, there is a very specific and very safe way to do this. Here is your action plan for the first week. First up, you're going to mix about a teaspoon of salt into a cup of warm water to make a gentle rinse. After that 24-hour mark, you can start using it. Just let the water kind of fall out of your mouth. Don't spit hard. You can brush your other teeth like normal, but for the actual extraction site, a Q-tip dipped in water is your secret weapon. Just use it to very, very carefully wipe around the area. Gentle is the name of the game here. Okay, a week has gone by, you're probably feeling a whole lot better. You might be thinking, phew, I'm in the clear. But there is a hidden risk that can pop up weeks, sometimes even a month, down the road. This is the part nobody really expects. And here it is. As that gum tissue starts to heal over the top, the hole in the bone underneath is still pretty deep. It's the perfect little trap for tiny food particles to get stuck way down in there. And once they're trapped, they can create a nasty little breeding ground for bacteria, leading to a painful infection long after you thought you were done healing. So, how do we fight this? Simple. Irrigation. Starting about a week after your procedure, you need to actively flush that socket out. Your dentist probably sent you home with a little plastic syringe with a curved tip. All you do is fill that with your saltwater solution, aim the tip right into the socket, and give it a good firm squirt. That pressure will blast out anything hiding down there. Just make it a new part of your routine after you brush. Now, whether we're talking about an infection in the first few days or one that shows up a month later, the warning signs are almost identical. It is so important that you know what to look for so you can act fast if something doesn't feel right. So you need to be on the lookout for a few things. Pain that gets worse instead of better is a huge red flag. The same goes for swelling that's increasing, any redness, running a fever, or seeing any kind of pus or discharge from the site. These are your body's alarm bells, and you have to listen to them. Look, this part is non-negotiable. Don't wait it out or see if it gets better. If you have any of those symptoms we just talked about, you pick up the phone and call your dentist or your oral surgeon right away. Getting help early is everything. And when you do make that call, just know that this is a totally solvable problem. Your dentist knows exactly what to do. They might need to prescribe an antibiotic to clear things up, or maybe they just need to professionally clean out the socket for you. Either way, they can fix it and get you right back on the road to healing.
So, as we wrap up, it all comes down to this. From protecting that all-important clot at the beginning to flushing out that socket later on, you now have the complete playbook for a smooth recovery. So the only question left is, what's the one step you'll make sure to remember? Thanks for tuning in, and here's to a speedy recovery.